Hi, my name is Betsy, and I'm currently a psychology major here at Cal Poly, which is why I decided to do my case study on depression because mental health is something that is not only important to me, but also interests. So, my chief complaint for this patient is that she has been feeling really down for the past few months and she doesn't enjoy anything anymore. The subjective for this patient is that she is a 28-year-old female presenting with complaints of persistent low mood fatigue and lack of motivation for the past 3 months. She reports feeling sad and empty most days and states that she has trouble getting out of bed in the morning. She denies any recent major life events or trauma, but notes increasing difficulty concentrating at work and declining performance. The patient reports poor appetite, resulting in a 7-pound unintentional weight loss. She endorses insomnia, stating that she has trouble falling and staying asleep, but she denies suicidal ideation and admits to occasional thoughts of hopelessness. She has no history of psychiatric illness, though she mentions that her mother was diagnosed with depression in her 40s. As for a little bit more about this patient's history, starting off with her medical history, um, there is no chronic medical conditions that she is diagnosed with. However, she does have occasional migraines, but they are self-managed, and she has no prior psychiatric or diagnosis or hospitalizations, as well as no known allergies. Her immunizations are up to date, and she is currently not on any medications. As for a little bit more about her family history, her mother was diagnosed with MDD, as mentioned earlier. Her father has hypertension and type 2 diabetes. Her younger brother is healthy with no medical or psychiatric issues. Her family shows no history of bipolar disorder, schizophrenia, or substance use disorder. As for a little bit more about her social history, she does live alone in a one-bedroom apartment in which she recently moved to. And this is a completely new city, and she moved 6 months ago for work and works full-time as a marketing coordinator. And she reports increasing difficulty concentrating and reduced job performance. She does not smoke, however, she will occasionally drink and have 1 to 2 drinks on the weekends. She denies illicit drug use and does not regularly exercise, but she did note decreased physical activity over the past several months. She has few local friends or support systems since relocating, but she does stay in contact with her family over the phone. She is also single with no children. As for my discussion question, it is considering the patient's recent life changes, social isolation, and family history of depression, what biopsychosocial factor is most likely playing a significant role in the onset of her depressive symptoms? And the options for this are A, genetic predisposition due to her father's hypertension, B, psychological stress from social media use, C, isolation after moving to a new city with limited support, or D, history of migraines managed with over-the-counter medications. And you can go ahead and pause, but I will be revealing the answer. And the answer is C, social isolation after moving to a new city. This can happen to a lot of people, especially in situations like this when you go to having a huge support system and being surrounded by tons of friends and family to becoming super isolated. It can be a drastic change for someone's life, and it can be very hard to adapt to. Um, and instances like my patients, it can even be so hard that it leads to major depressive disorder. As for a little bit more about depression, its clinical definition would be that it is a common and serious mental health condition characterized by persistent feelings of sadness or lack of interest or pleasure in most activities, lasting for at least 2 weeks. It affects how a person thinks, feels, and behaves and can lead to a variety of emotional and physical problems. Some other names for this are major depressive disorder, which I will be continuing to use throughout this presentation, clinical depression, unipolar depression, and major depression, as well as some prefix and suffixes. The D in depression means down, the press means to actually press, and the ending means condition or state. Um, as mentioned earlier, symptoms need to be at least recurring for about a 2 week period, and at least one of the symptoms must be a depressed mood or loss of interest or pleasure. And some of these symptoms consist of depressed mood most of the day, nearly every day, marked diminished interest or pleasure in all or almost all activities most of the day, significant weight loss when not dieting, weight gain or decrease slash increase in appetite, insomnia or excessive sleeping, psychomotor agitation or retardation, fatigue or loss of energy, feelings of worthlessness or excessive guilt, difficulty concentrating or making decisions, and thoughts of death, suicidal ideation, or even suicide attempts. As for my assessment findings with my patient, she does meet the criteria for major depressive disorder, but at a moderate level, and it seems like she's experiencing a single episode from this drastic change and as she is adapting to her new life. Um, my patient presents symptoms consistent with major depressive disorder as she reports persistent low mood, loss of interest in activities, fatigue, insomnia, poor appetite, difficulty concentrating, and these have all been present for over 3 months. She denies suicidal ideation but acknowledges feelings of hopelessness. She has no history of psychiatric treatment, and her social history reveals recent relocation, limited social support, and occupational stress, which are very likely the contributing factors to her MDD. As for her mental status exam, it revealed that her appearance was appropriately dressed but flat affect, and her mood came off as sad and her affect was constricted. Her thought process seemed logical and goal directed, and her thought content showed no delusions or hallucinations. Her insight and judgment was fair, and her cognition was mildly impaired concentration. As for some treatment options for my patient and others experiencing MDD, there are medications and prescriptions that you can have. These are a list of some of the examples that are very common for MDD, and you can start these um, at a low dosage and monitor side effects and efficacy over 4 to 6 weeks and increase the dosage if needed. However, there is also psychotherapy, which is very recommended and very common. And some of these things are cognitive behavioral therapy, which is very popular, and intrapersonal therapy, psychodynamic therapy, and supportive therapy, which are all different forms. This is also the 3D model that shows how depression can physically affect one's body. And in this picture right here, you see the decreased brain activity in the prefrontal cortex and where depression is directly affecting that. And then here is a closer picture of how depression is affecting the neurotransmitters and its activity within that. And these are my references. Thank you so much for listening.